Blood cultures are used when systemic bacterial infection is suspected, so a fever or chills. If septicemia is suspected, when a patient has chills, is ideally when the sample should be pulled, and it correlates with a bacterial quote unquote shower in the blood. You can also do a catheter culture, specimens drawn through IV catheter, but this is only for catheter sepsis. So blood cultures typically need to be drawn away from the catheter that's in place. Sepsis is a SIRS response, and SIRS means systemic inflammatory response syndrome, and it's triggered by infection. Septicemia is sepsis that's originating from an infection in the bloodstream. And as I mentioned, SIRS is a systemic immune response that has two or more of the following: a true fever, temperature above 100.4 or below 96.8 degrees Fahrenheit, a heart rate above 90 beats per minute, and a respiratory rate above 20 breaths per minute, and either an extremely high or an extremely low white blood cell count. Here are some bacteria that can end up in the blood causing a bacteremia, showing them broken down by primarily gram negatives, some gram positive, and then some miscellaneous. When obtaining a blood culture, this is typically done in a hospital setting, so it would be unlikely to do this in an outpatient setting. But you clean the skin and the culture bottle tops with iodine. Then there's two bottles that are preferred for adults, one that's aerobic and one that's anaerobic. And it's 5 to 10 milliliters of blood per bottle is the goal. Pediatrics, it's only one bottle. It's a lot smaller amount of blood. The recommendation is to obtain 2 to 3 sets of blood cultures at 2 to 3 sites, collected 30 to 60 minutes apart. You get a preliminary result within about 24 hours, and in about 1 to 2 days, you'll have bacterial identification, antibiotic susceptibility, and you can correlate any potential skin contaminants like staph epidermidis with patient symptoms and history. If there's no microbes after 10 days of incubation, the blood is considered sterile.